Barry Boudreau began seeing male pattern thinning hair 10 years ago. It was a familiar genetic sight.
When I was younger and I was growing up with all my father and my uncles, I didn't know grown men had hair.
But now he's turned to a newly opened clinic in Metairie for help.
Some people have said, oh, if you change your hair, it doesn't. I haven't grown any more hair, but I think my hair, my scalp's more stimulated. I don't feel that I'm losing that much on my pillow.
Sarah Hopper is only 23, but in the last few years noticed her hair was changing.
I'd take a shower and it was just like increasing, like when I'd wash my hair, how much hair would come out.
She too turned to treatment at the new Hair Loss Control Clinic of Louisiana.
It definitely feels more full, thicker. I'm much happier with it, feel more confident.
Hair Loss Control Clinic is new to Southeast Louisiana, but's been around for 25 years with more than 130 clinics in 29 countries. They focus on not one treatment, but a multi-therapeutic approach.
We've had 97% success in regrowing hair.
Clinics use prescription pills such as Propecia and several strengths of topical medication such as minoxidil. They say their conditioners, shampoos, supplements, and solutions cleanse and give nutrition to the scalp with DHT inhibitors, ingredients that block hormonal action that causes male and female pattern baldness called androgenetic alopecia. There's also a low-level laser with multiple diodes, technology cleared as safe and effective to regrow hair.
We are in the process of doing a study right now ourselves through our clients, and the preliminary numbers in that study are in the high 90% of people using the combination therapy of getting results.
Independent dermatologists who specialize in treating hair loss believe patients should first get a medical diagnosis to make sure it's genetic pattern thinning and not temporary shedding from having surgery, a baby, or extreme stress, or that it's not a gland, hormonal, immune problem, or even cancer.
The other thing we see is infections in the scalp from hair techniques, from weaves, from perms that are done irregularly. I have a number of patients that I've seen that have burned their scalp, and that has led to hair loss.
Chemical burns from salon relaxers need prompt injections by a doctor before scars permanently block hair growth. The only cure, transplant surgery. The doctors say the prescription medications the hair loss control clinics use do work, and that laser shows some promise, but the hype may be ahead of the science. Dr. Nicole Rogers published one of only 2 laser studies.
We did find that there was some improvement, and it wasn't for all patients. It was just a little bit of an average in the increase in the thicker hairs.
I'm cautiously optimistic that with early hair loss of a purely genetic, androgenetic alopecia mechanism, that we might see some improvement with this. I do not think it would do anyone any harm.
And the doctors say the science is very weak that saw palmetto or any ingredients in shampoos increase hair growth. Still, the Hair Loss Control Clinic says its products help the laser penetrate better and stands by its results of using several treatments at once.
Excellent results. We have before and after comparisons. Our nurse takes pictures through a special camera on a microscope, and you can see definite quite improvement. Our clients are very happy.
They say the staff has access to doctors and nurses to answer questions, and if pattern baldness is not obvious, they will not make a medical diagnosis.
Do you ever recognize a medical condition and send someone on to an MD, a doctor?
We have before.
For Barry, he's satisfied.
My wife does a good job of taking care of herself, so at least I can do is give a little bit back to her.
For Wrinkle Free Friday, I'm Meg Farris.
Well, Propecia is offered in prescription pills only for men to regrow hair, but the doctors say there is a new drug for women called spironolactone, and for more on that, go to our story on WWL-TV.com.